Dr. Tran, so a lot of folks are already on medication for depression and anxiety. So is it important for them to have therapy along with medication management?
Yeah, absolutely. And I think that's why we've spent so much time talking about therapy and self-care and what we can do for stress. While medication can have its benefits and help, and once we kind of work on getting patients on medications that can be helpful, I think the benefits of what it provides is getting us to a place where we're able to do the things that we would recommend in therapy, right? And so I always akin it to any other medical condition like diabetes or hypertension, or high cholesterol. The medication's there, and it'll get us to a place where the lab work will look better, but we still have to modify our lifestyle. We still have to eat better, we still have to exercise, and it's the same way with mental health. Medications can help temporarily, and over time it can help overall to lift our mood, our anxiety, and a lot of other stuff that we're struggling with. But it's a two-pronged approach when we talk about our mental health, and I'll always encourage for patients to get into therapy, and both of those combined is what's going to provide patients with the maximum benefit. So absolutely.
I'll piggyback on that a little bit. Because I just can't stop talking. A lot of times the medication is treating symptoms of a bigger issue. So just like diabetes, sometimes with if you're on diabetic medicine, it's, if you adjust your diet, you might be able to not have to have diabetic medicine anymore. You might go into recovery. And that can also happen with mental health also. Say you're taking a medicine for depression, you may not always have to. It just depends. It might be organic and a chemical imbalance in your brain, or it might be situational that's caused by stressors in your life. So if you can work with a therapist to figure out what the root is, like where is the stress coming from that's causing these symptoms, you can really address those head on and try to figure out better ways to cope. And then that would relieve the symptoms, which in effect could mean you might be able to take less or no medication at all. Some people are always going to take medication. That's completely acceptable and fine, but not everyone. I think, some people see medication as a fix-it, and it's the only fix-it, but it's not. Like Dr. Tran said, research shows that therapy combined with medication management is the best treatment. Studies show it's the most effective. The two components together are going to give you the best results.
Think of medication like an additional tool that you have in your toolbox. Sometimes it does help us to feel well enough to be able to begin to work on the things that are kind of contributing to us not feeling well in the first place, like they were saying, the root cause of it.